One, two, one, two, one, two, one, two.
Just walks to the bathroom. It's really it's right up to the sort of okay. I think I need some water. And can you please have the stage? Microphone is live. Microphone is live. Sorry, I'm in the okay. No, we'll wait. Thank you all for being here. I think we'll go ahead and start. Thank you all for being here. I'm Penny Jester. I haven't met you. These seminars, just to recap, we do them 3 times a month, the first 3 Thursdays of every month, and each month we have a different theme. This month has been about data and basically about data. So the first session of the month was on data, specimen repositories and biorepositories, certainly related to data. Last week, if you were here, we reviewed an article about the ethics of consenting when it comes to big databases and that sort of thing. And today, we're going to talk about REDCap. I know I've heard many people say that, that again, when you start a study, if it's your study, you need a database. And how do you get one? And how do you build one? And do you want to spend $3 million and pay someone to do it because it's very expensive to do it, to outsource it? So Emilly Mixon is going to speak to you today. And one thing I want to remind you, you all have a evaluation form. Please fill it out. We want to hear about any topic. It's anonymous, so whatever you put will be fine. And we want to hear about what other topics you'd like to hear about. Or we haven't been very good about marketing this, so if you haven't heard about this program, I'm not surprised. We're trying to figure out how to market that. And so Emilly is over in the Department of Pediatrics. She works with Karen Fowler, who may show up in a bit. And they've been using and dealing with REDCap for a while, and she's been learning how to use it. So we thought she'd be great to give us a comment. Sure. So if you could tell us what other things you've done in your research, thank you.
I've been, I guess, with the Department of Pediatrics for almost 18 years now, since I graduated from School of Public Health and my MPH in epidemiology. And Dr. Fowler actually was one of my professors. And so a research study came on board, and she had somebody to help her with the data, so I needed a job. So it just worked out, and I've been here. So luckily, those grants kept getting funded, and work kept coming in, so here I am. Primarily in the beginning, we did a lot of SAS, and we still do, actually. So in the beginning, we would use SAS for our data entry as well as data management and data analysis and everything. But I guess about 10 years ago, they got a bigger study, the CHIME study, which the goal was to screen over 100,000 infants for CMV, and it was going to be multi-site and was going to require a lot of data, more than what we could handle just hand entering. So at that point, we decided to look for other options. So let me just start with REDCap. REDCap actually is fairly new to us, and it's probably really good for small studies. So let's see if I get this. Okay. REDCap was developed actually by Vanderbilt University. It is a secure web application, so you can access it from anywhere. You can build and manage all your online surveys online and databases online. It is now overseen by a consortium, which consists of over 1,600 institutional partners in 92 countries. So it's very widely used. Let's see. You can have multiple users from anywhere accessing it in the web, which is very handy. So particularly with multi-site. And also within site. So if you have a clinical aspect, but you also have a lab aspect that needs to have access to it. You can have the lab personnel entering as well as clinical data going at the same time. So it's very handy. Can be installed in a variety of environments. It's HIPAA compliant and all those good things. You can create and design your projects online, or you can do it offline with dictionaries that you can create within Excel, and then they can be uploaded into REDCap. So once you have access to REDCap, you can build as many projects as you want. So you basically have a login and a password, and then from that you can go on your own. However, so the projects would be like the study. In my mind is how I have to picture it, otherwise it is. So each project is a study. So you basically have to come up with your study design, which you would do anyway. But then you would have, within REDCap, you would have a developmental mode. So you would, of course, during this time period, have access to REDCap. You could start building your forms, you could start working with it, trying to figure out how it's going to flow. At the same time, you're also trying to get your IRB approval, which is, of course, necessary before you actually start entering any research data, which we all know that. This is also time you test the forms and make sure they work. You're getting what you want and all of that. Once all that's good and done and IRB approves you, you can go to the deployment stage where actually the forms are active and you can actually start collecting your data. Production mode. So this mode can go on for ever how long it's supposed to for your study. And then it can be archived once your study is over and you're done. You're good to go. But you still have access to all your data, of course. It's just you're not adding to it. For Department of Pediatrics, the pediatric research office has been established recently, and REDCap is also being offered to pediatrics personnel. So you would contact the office, we would set you up with a login and ID, and you would have access to REDCap. Now, one thing about REDCap, there are tons and tons of online tutorials and also lots of tutorials within REDCap itself. And because the consortium is so large, all these institutions, a lot of them have their own training materials available. So it's very easy to find help and to figure out how to do something within it. There's also a huge library.
And can you mention who in the School of Medicine, or Department of Medicine, can provide access to REDCap?
Yes, Knowledge. He has that.
Great.
So he would be the contact within the School of Medicine.
Did you say the name?
Nozzle? Ismail?
Yeah.
I actually have to apply with your contact information. So you were on here also. So, pardon.
I'm sorry, we'll get handouts for everybody
Yes.
later. We didn't get them printed early. We'll have your email, if we have your email address, please let us, be sure you wrote it down for us and yeah, that's okay.
Oh, sure,
Sorry.
sure. So I have all the contacts in there, so hopefully you'll be able to find them. So I'm just really going to do, REDCap also offers a lot of standard forms. So like you can get basically a form that is already developed for demographics, and you can adjust it ever how you need to for your purposes. So, but what I want to show you is how very quickly, just demonstrate how easily it is just to go ahead and create your own from scratch. Basically, once you're in, you create a new project, you, I'm actually in trouble reading. You can, go to the designer. And again, on every page, it's going to have a little video that shows you how to use that page. So REDCap is very user-friendly. They want it to work for you. And you can create your new form, and basically you're just adding fields. So it always starts you off with a record ID, because of course you have to have, your individual ID for each observation. Again, there's a video that shows you how to use your page. And you can add fields. So these are the different field types. Depending on what kind of data you're collecting, we'll determine what kind of field you may want to select. I chose to do the mobile radio button. So basically, infections during pregnancy would be what we're looking for, would be your field title. You can specify what your choices are, and you name your you can name your variable, or REDCap will do it for you. And you can determine whether it's required or not. If it's an identifier, which this isn't, you can custom a line depending on somewhat. But REDCap is a little bit limited in how you can actually design the form and make it look pretty. You can do a few adjustments, but it's pretty much going to be just a line straight up and down. And then you save it and it appears. So if you go back, I went back to my projects, and these are just a couple of things that I've been playing with for one of our studies, the prep study. And it's a form that we actually had in Teleform, and I was just trying to see what it would look like in REDCap. So again, these are the forms that are under the prep study. And you can add more forms to your particular study. But I was looking at social history. And you can preview what it's going to look like to the person who's doing the data entry. This is the developmental look of it. But that's actually how it's going to appear when you make it live and enter. So you can add spacing into it to try to divide out different sections so that it kind of flows better as you're entering. And if you do it as a PDF, this is how it's going to look. So you could PDF it, you could print it, have hard copies. This is what's completed. And then you have your data entry person who's actually sitting and entering them in to REDCap. And it's going to flow just like it looks on the paper, which is what you want for data entry purposes. The basic strengths that we have seen with REDCap is support surveys, ad hoc reporting, event scheduling, file sharing, has calculated fields, has great skip logic. You can tell it ranges and date ranges. So as you're entering, it'll cue you in to, hey, wait a minute, that date's not where we need it. I need it from this time frame, not there. So as you're doing data entry, you can also be checking for data errors. It's easy to export it to SAS, SPSS, Excel, whichever. You can import data from anywhere in the world, as long as it's secure web authentication. Projects can be used by researchers from multiple sites and institutions, which makes it very handy. Validation and skip logic is great. You can modify the database or survey at any time during the study. However, this you need to be careful with, just to make sure that what you're changing isn't going to mess up something else. And we haven't actually played with this very much, but we do have some concerns over this. But theoretically, it should be okay. Data may be imported from external data sources, which I'll talk about in a minute. And also with this, it allows double data entry, which we would recommend for your validity of your data, as well as blind data entry. And the forms, of course, can be saved as PDFs. So the weaknesses, though, are you will need to export the data for analysis using another software package. So I think you can run basic statistics and basic queries within RedForm, but to do any significant analysis, you're going to need to export it. It is not a time-efficient option if you're collecting a large amount of data. So if you just have a small study, maybe under 100 total participants, and you're only collecting a few pieces, a few things, then it's perfectly manageable and probably, would be your best option. However, if you're doing a very large study, like the 100,000 that we were doing, this probably would not be the best way to go. If you're within the Department of Pediatrics, you would contact the Pediatric Research Office and we would get you set up on REDCap. Anybody who would need access to the database or project that's being developed would need their own login. But once you have that, you'll have access to REDCap. And you can restrict also who has access to what. So say you have lab personnel, you also have clinical personnel. You may not want the lab personnel having access to the clinic data, vice versa. So you can definitely restrict who has access to what. And also with the Pediatrics Research Office, we can provide as much support as you need. We'd be more than happy to help meet with you, sit with you, determine what kind of data collection tools would be advisable for your study, all the way to, doing it for you. So we're available, happy to help, call anytime. I was just going to show also this website project REDCap.org. This has all the libraries, has all types of videos that will help you do whatever it is you're trying to do within REDCap. It's very helpful. And REDCap, actually, you can add video into your surveys. You can add audio into your surveys. I mean, it's pretty impressive what you can do. I haven't actually had time to play with all those features yet, but I'm looking forward to it soon. And again, Department of UAP, if you're in School of Medicine, Nozzles is the one you really need to talk to. And he's very helpful, very friendly, and will set you up with what you need. Just quickly, within the research office, the other data management options that we offer, one of which is EpiInfo. EpiInfo is from the CDC. It's free.
And that's available to anyone, right?
And it's available to anybody.
So it's publicly available.
It's public, yeah, it's available. I downloaded it last week on my home computer, so anybody can use it. It is primarily geared for CDC personnel to do outbreak investigations, public health surveillance, that kind of thing. So a lot of the literature that you're going to find on the info and tutorials are going to be kind of centered for that focus. But it does reside on your computer, on your hard drive, but of course you would save your files to whatever server, the pediatric server or secure server that you have. Let's see the pros. You can create questionnaires, forms, and all kinds of things to collect or view your data. It's point and click. It's very user-friendly. Again, it has the validation and skip logic features that are within each field. So as you're adding a field to a form, you can dictate what the range is, what the valid values are, and all that kind of thing. Again, you can modify the database or survey at any time during the course of your study. Just be careful from a data management standpoint. Running statistical analysis, you can actually do some of this within EpiInfo. But there again, you can also export it out into SAS or SPSS, whichever. It's available in lots of languages. It may use the Access Database format or SQL Server database to create projects. You can collect data concurrently. Let's see, double data entry, of course, web surveys. I mean, it's really a very powerful tool as well. Most of the tutorials, again, are on the outbreak and epidemiology, or outbreak and epidemiology focus. So for clinical, it may be a little different, but it's probably similar enough to figure it out. And not a time-efficient option, again, for large data entry, because you're having to do manual data entry. But if you're doing a small study there again, that's fine. But this is what a EpiInfo form would look like. So paper-wise, this is the same social history data form that we had in REDCap. And where in REDCap, it's all going to be straight up and down. So one question right after the other. You don't really have any way of maneuvering it and making it look pretty and functional and less paper. So the REDCap form was 4 pages. This one would be 2. So you have a lot more leeway as far as moving your fields wherever you want them and trying to get as much on one page as you can. But if you're doing medical chart abstraction and such, less paper may be helpful. The other option, which is one that I have worked with quite a bit as of late and is sort of my personal favorite, is HP Teleform. Teleform is a software that will allow data automation. So you replace high-volume manual data entry with converting your data forms into digital data. So you have hard copy forms, they're filled out by the study personnel, they're sent to the site. We have a high-speed scanner that scans them in. Teleform pulls out the data for us in a very concise, non-specific way of explaining it. And you have what's called the verifier module. So a data entry operator will manually sit there and go through each form, comparing what was written on the form versus what Teleform saw to make sure it's what it should be. It interpreted it correctly. We currently, within our division, have four teleform designers, scanner and verifier licenses that are specific to computers within our area. We also have 2 high-speed document scanners that are also available within our suite for use. And the thing with Teleform, once it's exported, of course it resides on the active server, so it's all secure. The pros, time saver for data entry when you're entering large amounts of data. So it'll process 100 forms easily in an hour. So that's somebody sitting there and using the verifier and verifying if the data is correct. So easily 100, maybe more, depending on the form. It's flexible, it has a very customizable form designer. You can export it to Microsoft Excel, Access, SAS, whatever. Save forms and PDFs for data collection offline. And it's possible to use in conjunction with REDCap. So actually one reason we were interested in REDCap was potentially actually using Teleform to get our data into an electronic version, importing into REDCap, so that lab personnel could then have access and add to the data. So it's more, you may end up seeing that there are ways to use multiple sources in doing your data entry. Now the cost is a little bit prohibitive. It is costly. It requires an annual contract for updates so that the system stays up to date. It does require high-speed document scanners. And you must develop a data structure for the database through either Access, SAS, REDCap, or whichever. So in other words, once it's out of the way we export it, it's a CSV file. So it basically looks like just a text file with all your data, just in lines. So you've got to get that into some way so that you can do something with it. So for us, we use SAS. So we just pull into the SAS, I import it, and you can develop your new databases that way. And when you're dealing with a whole lot of data, this is really the way to go. But this is what a telephone form looks like. And you can always tell a telephone form because it has those 4 boxes in the corners. And it has that little funny looking thing at the top of the number. That's your form number. But with Teleform, anything is possible as far as your form design. You can shade, you can color, you can do all kinds of things. And you can move anything anywhere, and you can resize it all, and you have a lot of control. But, which is really great, and I love that part of it, but I can see also where that may be too overwhelming. Almost, there's too much you can change. So, REDCap or REDInfo actually may be the preferred choice. So it just kind of depends on what you need. But from a data management standpoint, whatever software you want to use to collect your data, you really need to consider what it is you're collecting and what it is you want. There's going to be some information that you'll need to have in order to follow your participants. You're going to need emails, addresses, phone numbers, all those things, your contact information, in order to keep up with your participants and to maintain contact with them and keep them coming in for study visits and whatnot. This probably likely is not going to be the same as your permanent research data. That's different. So your permanent research study data is basically going to consist of like your study ID, date of birth, race, demographic information, and other information that you're going to need to answer your research question, whatever it may be. Whether it's diagnostic information, test results, laboratory stuff, that's going to be your research. That's what's going to be in your research study database. Now, REDCap, I understand, does have a calendar to it, so it may actually be helpful in keeping up with contact information and useful for contact database as well as research. So it might have 2 different uses for individuals. Also, you want to develop your source documents before you actually do your database, from our standpoint. Just because as you're developing your source documents, you're really having to think through the whole process of how are you going to obtain this data? When am I going to get it? Your basic demographics, maybe you get an enrollment visit and you get it quickly with your first interview, but there may be test results that are going to come later. So all that kind of affects how and the timing of when that gets into the database. And it's okay if it comes in later, but that all has to be figured out and designed. And it may be that you're going to need multiple forms, which we have no problem having multiple forms. And you link them all later. So you may have a visit form for each of your visits. And then you may have an enrollment form that you see in enrollment. But if you're collecting lab samples, for us, we have specimen lab sample forms. And then we have result forms that are linked with those specimen forms. So, I mean, it can get complex really quickly. But if you have a good system and you thought it out, by the time you get to developing your database, that's sort of the easy part in a way. I mean, designing the forms is kind of fun, and at that point you've already thought about, this is the data I need, so, you know, how is the best system to do it? So there's a lot of work that goes into it before you actually get to this point. But there again, here's my contact information. Happy to help. Always in my office usually. Any questions?
One question that I do have is, in your baseline information where you enter, your demographics, like the age and sex and all that, that continually shows up on each visit. Do you have to fill that out at each visit, or should it go back to when you filled it out the first time?
You mean like in REDCap on a form?
Uh-huh.
Well, it depends on the form. I mean, for us, typically we have just one, you know, the visit is form specific. Does that make sense? So like you would have a form that you would collect at enrollment that would have all the information on it.
Right.
And it isn't automatically.
No,
updated on each form.
it should.
It's how you build it that matters.
Exactly.
So if you only want it to show up that first baseline, then you would do it just baseline. But the way
Right.
you build it.
So you just go into that form, enter that information at the baseline visit. At the next visit, you have another form that you complete for whatever information you're gathering at that visit.
But the study ID or the participant ID will tag to the.
It'll link.
Right.
Yeah. You
The ID is.
So you don't really have to participate in that Congress every time. For longitudinal studies, you can assign the forms to special events, but then this participant ID will pull out the demographics or link those entries to the demographics.
Okay, because I mean, like, someone else set up our REDCap for a particular study, and so it's like, so I feel like I have to re-enter that information every time.
So it was how it was built, it sounds like. Yeah,
Yeah.
whoever built it did
that.
They can change it.
Um,
Yeah.
If it's redundant information, because it's still going to be linked to that one placement, so you can request it. I mean, I would imagine you could have it so it pulls in and everything, so you see what's there, and then you just add on the new information for the new visit.
Yeah, there's
I mean, that might be
one project we're involved with where they need to, not every visit, but every 6 months or every year, they need to see if there's any update to the contact information, so we attach the form to those visits only. But you can certainly exclude or include it depends on your study protocol.
Mm-hmm.
What do you mean by, and I just might not understand it, double data entry? What do you mean by that?
It can depend on a number of ways. Typically, you have two different people entering the same data, and then you compare the two, and you check for errors. It's a way of making sure the data that's going in is valid and accurate as possible.
So that's like when a monitor comes and checks, it's like, I just do clinical track.
No,
No.
typically like the data entry process.
It's part of the, it's a
Yeah.
standard data management process that is often done. If it's hand-entered data, a lot of times you do double data entry to make sure it's accurate. Then the monitor comes and looks at the source to make sure it matches what's in the database. But your database then is just that much more
Is that
rigorous.
a newer thing?
No,
No, that's,
it's been around for years.
yeah,
15 years. Depends on the data management group.
right.
We always used, for many, many years, we used Department of Preventive Mental Health. It was a Cancer Center Data Management Group, and then they moved to the DOPM. But they always did hand data entry, double data entry, comparing it, and then resolving the discrepancies so that it was accurate.
You really want it as accurate as possible up front. We're going back and making queries and making corrections
we were working with the group once who kept insisting they were doing double data entry, but both people who were entering the data obviously were misspelling words. And so we finally figured out they really weren't doing double data entry. But,
Yes, I have a question. For long-term studies, like when you need kind of live data, because we use REDCap, but for example, we work with patients with chronic kidney disease, for example, stage 3, and you come back 6 months later and they're probably stage 4 now. You know, this is not live data, right? It's not recommended to keep a long-term study like that.
What, the telegram or
No, the REDCap.
the REDCap? Well, I mean, you have your data. I mean, it depends on when it's entered and how quickly it's entered and how, I think it's really going to depend on your data management personnel and how it's set up.
But I don't think
But it may not be,
it does not be like impact, for example.
oh yeah, no, it's not going to be like that necessarily.
Because we have a long database, and then we
Well, I mean, I can see
maybe-
where it could be fairly accurate though. I mean, if the data is being entered immediately and other people have access to it.
But if you come back a year later and you want to see patients that have chronic kidney disease stage 3 right now, it won't work because
It's just going to depend on what's in it, what's been entered at that particular time.
some of them maybe have that and you know, I mean, I don't agree with it.
It may just, yeah, you know, it's going to depend on how it's set up and who's entering the data and when is it getting entered.
You probably use a database that doesn't need updating, you know, the patients, it's constantly changing, you know, like in the like the last week change or the diet or whatever.
Well, theoretically,
Well,
This is a data entry system, not a database. So there's a, you know, with
Well,
REDCap,
well, you
you're
can-
actually entering in the data from another source. So
Yes, but you can use, the source will get outdated too soon, that's what I mean.
It kind of depends on what your study is, because most of the time you want the history.
Yeah.
You don't want to change anything, you just want to add to it. But again, it depends on what kind of research you're doing. Most of the time you don't want, I mean, you want what's current, but you want to know what happened 2 weeks ago. You want to know what looks, so it's not replacing, it's adding to. And that's, I mean,
We can never have the current because it's already old. Like, we have been trying to use it for stability type of reports. Like, let's see how many people we have right now with any given disease. And then you go back and you get the report and you people from that you entered a year or 2 ago, and right now they.
Well, I mean, because of the database, it just will compile the data that you've been entering over
Can
time.
I say something?
And some people haven't come back to it.
What might help you is you can run through Impact, you can run queries, and you have to go through official people to do it. But with a certain diagnostic code, and they can sort them according to their deceased or not, or at least if it's been updated on the disease status, that might help you since yours is changing so rapidly.
Thank you.
what's your experience been with REDCap? And have you used info?
Yeah, I'm not with now I'm with the Department of Medicine. So we've been doing REDCap for 5-6 years, but I've been here, this will be my 3rd year. So we have totally revamped the REDCap infrastructure. We have made it more secure, more accessible, and we are a service center. So if you're with Pediatrics, please go to Emilly. But any other department, you can come to us, and then we'll be happy to help you. So so when I started, we had 100 projects. Now we have 250 projects, and almost 60 of them are NIH-funded projects. We recently became validated by NIH last week, and we were working on the ISSO over there to further enhance some of the controls. So we were secure, and we were working with the next step to have a FISMA compliant REDCap infrastructure and central IT. So I mean, the REDCap has some limitations, like it can't host the FDA because the billing component is not present. but for many of the other projects, I mean, we haven't had to say no to any faculty yet. So it has worked beautifully for us. I mean, we are doing all that advanced feature, double data entry, DAG, multi-site, calculation, ranking logic. So, I mean, it has worked beautifully. So, we also provide a complimentary overview session. We'll be happy to host one for you.
Any other questions? So, on the HP teleform, y'all are the only people that have one right now.
I think there may be some other
There's
telephones
some
on
other
campus.
things.
STD uses telephone as well.
But we're offering it for the Farm Pediatrics as part of the research office. As an option.
They had used it for a while at the DOPM. And I know that there's a license you have to get for the.
It's fairly expensive. So, I mean, you basically buy it.
Really large scale.
Yeah, so, I mean, you buy it for a computer. So, like, there's one computer that's going to run telephone for you. So it's not, you can't move it around. Let me get that way. That makes sense. Got to stay in that one spot.
We used Teleform for a while, and our biggest challenge was the way people wrote.
It is tricky.
It made it really challenging to,
Yes.
and if they type it in, I guess that was helpful, but if the printing came out right, then when we scanned it, it still had to be,
If
You
you're
have to-
typing it, then.
you have to hand enter it in. So,
Well, the thing with teleform, and with any data form particularly, the more you can do like bubbles or checkboxes or, yes, no, true, false, or, mark your diagnoses, don't write them out, just have them limited so you have choices. The better your data is going to be, and the easier it is going to be to get it in, and the more valid it's going to be once it's in. Now, with teleform, it's true. If you have any fields that you have to have somebody write in, particularly numbers for lab results and such, it can be tricky. But really, with even when you're verifying those forms, you can skip almost all the time. You can skip the bubbles because those are always going to go through correctly. And just have it so you're just going to those fields that are having to be handwritten and verifying those. So you can limit within teleform what you're actually having to check. So, but it is true. I mean, people's handwriting, and also you have to make sure it's a dark pen, and they write within the blocks, and there are all those things. But still, when you have 100,000 observations with multiple forms coming for each of those people, it helps. It just depends on the study and who's going to be entering the data and how comfortable they are with different programs and the process. So there are options. And really, I think REDCap's a pretty decent option for most studies. I mean, they're the small ones.
Here's a question, I don't know if there's an easy answer, but let's say you're an investigator who's just starting a study and you need to figure out which system is going to be best for you. And Lasmo and Dr. Fowler, can you guys be consultant? Can you be consulted to say what might work best with them? I'm just asking, because if you're really new to using any of the systems, picking the best one, not so easy.
Yeah, I think the smartest thing you can do if you're getting ready to start out is you go visit all of us.
Okay,
And talk,
look at all
and talk to other people who have experience. Because it's really helpful because they'll kind of throw some things out and think, oh, yeah, I hadn't thought about that. That's a good idea. I want to go this way with REDCap or whatever. REDCap's really nice because you're learning it, and it's got so many great resources out there. Even if you don't know, you can get online and watch a video. Everybody's talking about it. In fact, I'm on the late thing. I had to dump it all out off my email, so I don't see it all the time. There's just constant stuff coming
I use
in.
my Gmail for that.
Yeah. If you want to be
I
on
can
kind of
keep up
there, like where people are asking questions, you don't want it coming into your email. It's like every few seconds, all day long. And so they're international users, so it's coming in the night too. So, but I think, you can kind of do it, and you may find that you're not going to find one choice for every single study. you know, it may change. That's my opinion, but
Well, it may be you use the combination, so like the teleforms and filling it into REDCap, or.
yeah, we're thinking about doing that on a study with doing pilot work right now, where we may have a laboratory report in, do REDCap, and then we'll take the clinical data and pull it in, and just like periodically, I think that's gonna work. But we haven't like got all the bugs out of that system. And as you well know, the bugs are always the people. Sometimes it's the software, but it's us.
I like that.
You know, that we have to train the people ourselves as well as others, and that's always the challenge. Even filling out source documents, which Penny knows well.
I have a question too, because I only know one resource on campus for this. A lot of times it's happening where they know they want to use REDCap, but I'm the one that's going to design it based off the little grant proposal that they turned in. And they have this idea in their head, and I'm designing it. I'm like, this is going to be horrible statistically. You need to be more specific. And I'm doing all this. Well, I don't have a background in statistics. I only know like one person on campus to go to. I've been using him for quite some time, and I'm sure he would love it if I put something him too. But is there anybody that's kind of in with IT and REDCap that also would be a good statistical person to kind of help me sort that out?
The way that we work, when the PI approaches us, they already have their statistician in place. So we work with the statistician to make sure that we do the randomization and all those things right. So we work with the statistician closely.
I think if we could make people do what we wanted them to, every investigator would work with a statistician, period, no matter what study they were doing. At least have someone to
Or
talk
an
to.
epidemiologist, I think.
Yeah, I agree with you on that. Well,
Yeah,
you've
because
got that
we do
same
observation
mindset.
studies, so we don't necessarily need a staff.
There's also the CCTS has biostatisticians and folks you can contact if you don't have anybody else to contact. But you're right. I mean, there are a lot of different titles that understand data management. You just need someone who has that expertise.
Well, and it's true. I mean, I think a lot of times people who are just starting out doing research don't really understand how complex it can get very quickly. And really thinking about what the data is they need to collect to answer the question. And I think that, and it's hard. I mean, it's kind of hard to explain that to somebody who's never done it before. But it's true, trying to get them to think through the whole process. Okay, so this is my question. What data do I need in order to answer that question? And how am I going to collect it? And where is it going to come from?
But you're right. Writing a protocol is one thing. Getting it onto the CRM is knowing what data is needed.
Right. I mean, like, I'm the one that's like looking at it, going, this is not going to give you what you want. But like, I don't have that level of expertise that's sufficient. Thank you.
Yeah. Thank you all for coming. We really appreciate your time. And if you didn't get a handout, let us
Was going to be built to work. In the REDCap, I can't remember what it was. I think it had something to do with the trails. like a data trail.
Yeah.
Is that what you understand?
That's my understanding. I know, I don't know that much about it, but my understanding with the FDA is, every little time, every change, every person who goes access, all of that has to be tracked.
Yeah, so that's why I decided to go department.
And you need to put together, I mean, is that kind of?
Where they use theirs and they feel